Hi, I'm Justin Riley. Today on Wisconsin Doctors, 3 distinct medical specialties that all work together in a very close way. We're talking about speech pathology, otolaryngology, also known as ear, nose, and throat, and audiology. We're on location at Bluff Medical Center to learn a little bit more, and my guests will include Angie Olson, physician's assistant, Colleen Quinn, the director of speech pathology, Dr. Rob June, audiologist, and Michelle Messer, licensed practical nurse. That's all coming up right here on Wisconsin Doctors. Stay right here. Welcome back to Wisconsin Doctors. We are on location at Bluff Medical Center, and today we are learning a little bit more about audiology, otolaryngology, and speech pathology. And my first guest is Angie Olson, physician's assistant here at Bluff. Angie, welcome. How are you?
Good, thank you.
Good to have you with us. So you're a primary care provider. Can you talk a little bit about what it is that you do first?
Sure. As a physician assistant, I see patients of all ages for a variety of issues. Anything from managing chronic illnesses to annual physical exams, sick visits, and maternity care. I see patients at Delton Family Medical Center, but I work with providers across the Bluff organization to provide care to patients. I enjoy building relationships with individuals and families as I provide care for a variety of health and wellness issues.
Yeah, it's providing those relationships or building those relationships is so important, as I found in some of these places. As we've done this show for a while, that's so important to a lot of providers.
It is.
So that's awesome.
Yes.
Awesome.
Angie, because your specialty is so broad, you have the opportunity to care for patients in a variety of ways. Can you tell the viewers about your particular role in regard to the speech and hearing health of your patients?
Sure. I screen patients for speech and hearing concerns at each well visit. For children, we assess response to noise and speech and language development. We discuss noise protection and how important it is to talk and read to baby every day. We participate in a Reach Out and Read program where we're able to provide books to kids 6 months to 5 years at each well visit. We know how important reading is for speech and language development. As patients age, we assess for decrease in hearing and swallowing difficulties. Having a relationship with the primary care provider is important because regular checkups allow us to keep you at your best and allows us to investigate and determine if there's any problems early on.
So swallowing difficulties, that's interesting. Is that related somehow to speech and hearing? I mean, is that a part of it?
Yeah, so Colleen works with patients regarding swallowing concerns as well.
Okay, so we'll hear about that later in the show. That's awesome.
That's great, Angie. We do appreciate the referrals you send our way. Could you tell the viewers how you determine who may benefit from specialized speech and hearing care we provide at Bluff?
I refer patients for speech and hearing evaluations for a variety of issues. If a child is not meeting developmental milestones in regard to speech, that normally results in an evaluation for hearing and speech exams. Other reasons I may refer patients are for chronic ear infections, personal or family concerns regarding a decrease in hearing, or abnormalities on physical exam. It's a great benefit that we have an audiologist available at Delton Family Medical Center on Tuesdays. There's also health fairs provided through Bluff which allow for hearing evaluations, and if that hearing screen's abnormal, that would be another reason that they may require a more thorough evaluation. As a primary care provider, there's a lot that we can do for you, but there's also times that having those referrals to specialists is important.
Absolutely.
So Angie, we at the UW Specialty Clinic, we have a really good working relationship with you and with the other primary care providers. Can you talk about, what do you think is the biggest benefit to our patients in order to have that comprehensive continuation of care and they kind of get a package deal from Bluff?
Yeah, so we have many specialists throughout Mile Bluff. Everything from general surgery to orthopedics, sleep medicine. We have podiatrists as well as the audiologist and sleep specialists. Having the specialists from other places, including UW Health, is just another way that Mile Bluff is able to provide those services to our patients. And we know how important that is in getting our patients the care that they need.
Absolutely. We got to take a short break here, but when we come back, we're going to be talking about speech pathology right here at Mile Bluff Medical Center. Don't go away, it's Wisconsin Doctors. Hey folks, welcome back to Wisconsin Doctors. We are on location at Mile Bluff Medical Center in Mauston, and succinctly put, our topic today is speaking and hearing. So next we will be talking with Colleen Quinn, who is the Director of Speech Pathology here at Mile Bluff. Colleen, how are you?
I'm doing well, thank you.
Good to have you with us. Can you give viewers an overview of what it is you do as a speech pathologist?
Sure. As a speech pathologist, I evaluate, diagnose, and treat communication disorders and feeding and swallowing disorders in people of all ages. So this would include children who are having trouble acquiring their language skills, could be children who are speaking but are difficult to understand because they're having trouble with the sounds. It could be adults who have had strokes and they're having difficulties with their communication or their swallowing abilities. It could be adults who have neurological diseases such as Parkinson's disease or ALS, who again have difficulties communicating or swallowing. I work with fluency disorders such as stuttering, voice disorders with chronic hoarseness. So it's a wide, diverse population that I work with, and that's why I enjoy my job as much as I do.
I think that's so fascinating that swallowing is such a big part of speech pathology. I mean, that's not something a lot of people think of.
No, you don't. As you think of a speech pathologist, you think of just talking, but swallowing is a major area that we work with.
Yeah, definitely.
Right. Colleen, could you tell the viewers when is the correct time to have a child evaluated by speech pathology?
Sure. A lot of people I always hear, oh, I think they'll grow out of it. But what I've learned and what I believe in as a speech pathologist, the earlier we can evaluate a child, the better. Even if a parent or their physician has any concern, it's really a good idea to have them evaluated by a speech pathologist. Oftentimes, we can tell the parent that, yep, things are progressing as they should be, and maybe just give the parent some ideas of what they can work on to help enhance the speech and language development. Other times, some red flags might prop up, and then we might recommend some therapy to help the child. A lot of research really shows that if a child's communication skills are delayed when they enter their schooling years, it's going to have a negative effect on how they do in schools. We want to get these kids as early as we can.
So having an evaluation done on your child does not necessarily mean that they need therapy?
Absolutely not. It's usually a good time to educate the parents, give them some information and things that they can work on in their home environment.
Great.
Colleen, can you tell the viewers more about how you evaluate and treat people with swallowing difficulties? How can you tell someone you care about may have swallowing difficulties?
Well, let's start with that. The most obvious symptom we see with people with swallowing difficulties is the frequent coughing or choking while they're eating. But there's other subtle things that we look for. Oftentimes, the person might say, I've got a lump in my throat, I can't get rid of this lump. It might be a lot of throat clearing. It might be the person is avoiding eating certain foods, such as meat or hard vegetables. It might be a gradual weight loss that's unexplainable. How I evaluate is I can do a bedside swallow evaluation or a clinical swallow evaluation. With this, I pretty much observe the person eating as different consistencies. I can give them different strategies to try to see if that'll improve their swallow. The other evaluation I do is called a modified barium swallow evaluation. This is done in conjunction with radiology, and we have them swallow different consistencies, and we can actually see the swallow working as they're doing it. And again, I can give different techniques and strategies to help their swallow.
Very interesting.
Colleen, I just found out you were recently certified in a new program to work with Parkinson's disease. Can you tell us all about this program and the viewers?
Sure, I'm real excited about this program. It's called the Lee Silverman Voice Treatment Program, or LSVT. It's designed for mostly with patients with Parkinson's disease. People with Parkinson's disease often have trouble communicating. Their speech becomes mumbled and difficult to understand, sometimes really soft. This program is designed to improve their speech production, make them more intelligible. I'm real excited to bring this program to Bluff Medical Center.
That's awesome. We got to take a short break here, but when we come back to Wisconsin Doctors, we'll be talking with Dr. Rob June, Doctor of Audiology. You won't want to miss it. Stick around right here at Bluff Medical Center. Welcome back to Wisconsin Doctors. We are here on location at Bluff Medical Center, and we've been talking about speech pathology, audiology, and otolaryngology. And it's such a mouthful to say, but I love saying it. And next we'll be talking with Dr. Rob June, audiologist here at Bluff Medical Center. Dr. June, how are you?
Very good.
Good. So talk to us a little bit about what inspired you to become an audiologist. It's a very specialized field to go into in the medical industry. What inspired you to go that route?
Excellent question. Basically, back when I was attending the University of Wisconsin Eau Claire as an undergraduate, I had sought therapy for a lifelong speech disorder known as stuttering. While I was receiving therapy for a stuttering disorder, I had the opportunity to meet other peers who were stutterers of all ages, both male and female. And furthermore, both my stuttering professor and another speech pathology graduate student are stutterers themselves. This inspired me to overcome my fear or help overcome my fear of public speaking. While going through speech therapy at UW Eau Claire, I was exposed to the speech pathology profession, and I enrolled in courses in the speech pathology program there, and realized at that time there is an audiology profession, and with my background in math and science, I pursued the field of audiology.
Excellent. That's a great story. Very inspirational. Very cool.
Rob, can you tell viewers what an audiologist does?
Great question. Basically, an audiologist is a healthcare specialist who is trained in identifying, evaluating, and treating disorders of the hearing and the balance system. We primarily work off of a physician referral, and we see patients from of all ages, from newborn through the geriatric population. For the newborn population, we can conduct a universal newborn hearing screening to identify hearing loss at a young age. We also see children and the adult population. With these groups, we can determine whether or not they have a temporary or a permanent hearing loss. We can conduct testing for dizziness and vertigo. We can conduct what's called an auditory brainstem response test for patients who might have a single-sided hearing loss or single-sided ringing of the ears. We also can perform earwax removal, and we also do educate the general public. And I would like to let the viewers know we do have an upcoming seminar related to hearing and some health conditions that could lead to hearing loss. It's held on Wednesday, May 11th at 10 o'clock right here at Mile Bluff.
Excellent, excellent. So hearing, you're a hearing doctor. A lot of people think when they hear audiologist, they think, oh, you're an ear doctor, but you're really hearing. You're addressing the auditory nerve and the way people hear.
That is correct.
That's awesome,
Yes.
yeah.
Rob, can you walk viewers through what a visit to an audiologist is like? Is it painful?
Definitely. Basically, I will do a chart review before you arrive, and upon your arrival to our location, I will conduct a thorough case history. I will explain to you step by step what types of tests you'll have conducted in an approximate time frame. I will test your hearing and let you know the results and any further recommendations. Basically, depending on whether or not you have a temporary or a permanent hearing loss. If you have a temporary hearing loss, you might warrant an ENT referral to our UW specialty clinic here at Mile Bluff. Also, if you do have temporary hearing loss as a child, it might warrant a referral to a speech pathologist for a speech and language assessment. And also we do see dizzy patients as well that may warrant a referral to a physical therapist for treatment.
So you're working with the inner ear and the outer ear, it sounds like.
That is correct.
That's excellent. That's excellent. We got to take a short break, but Dr. Rob June, thank you so much for joining us today.
Thank you.
Don't go away. There is more Wisconsin Doctors coming up right after this. Stick around. And welcome back to Wisconsin Doctors. We're here on location at Mile Bluff Medical Center. We've been talking about speech pathology, a little bit about otolaryngology and audiology. And now we're going to talk with Michelle Messer, who is a licensed practical nurse here at Mile Bluff Medical Center. Michelle, welcome back to Wisconsin Doctors, I should say.
Yes.
Good to have you back. It's been a while.
Good to be back.
Yeah. So what type of conditions would a patient need to see an otolaryngologist for?
Okay, well, I work at the UW Specialty Clinic, and we work really close with the primary care providers here at Mile Bluff and even in the neighboring communities. So we ask the patients see us when their primary care has some issues and they need to come to us, and we work together to figure out what to do for the patient. So first thing, one of the things is hoarseness. If a patient's having hoarseness and they're not being able to determine what it is, we will see the patient. We see them for hearing loss, which we usually have to do that before somebody is even allowed to have hearing aids. The doctor will determine, what could be causing the hearing loss. Tinnitus, which is ringing in the ears, and we have that here in Juneau County because we have a lot of hunters, and they don't use their ear protection, and they get this ringing in their ears, so that's really important. Swallowing difficulties, people who are having difficulty swallowing, determining if, what is the cause of that, and if there's something in their throat or if there's a mass there. We're able to treat that and look at that, and also nosebleeds. Those are some of the few things that we do. So if somebody has chronic nosebleeds and they end up in the emergency room, they usually will come to us to see what do we have to do to stop the nosebleeds.
So as it relates to speech and hearing, you're really trying to figure out what physically might be causing these issues.
Yes,
okay.
Exactly right.
Okay.
Yes.
Good to know.
Yes, and some of them play into each other too. They do. You're right. Hearing and your throat all can be connected.
Yeah, absolutely.
Exactly. Great. Could you tell us what type of procedures can be done at the clinic appointment?
Sure. We do a lot of ear cleanings, which usually come from you because you're doing your audiology, and it's difficult for some patients to get their ears cleaned. So we use we have a microscope and a suction to be able to get, clean people's ears and then send them back to you so you can do your testing. We also have an ENT scope that we go down patients' throats. And we do it right at the clinic. We just numb the area a little bit, and the doctor goes down to see if he sees anything down there, any masses or ulcerations. The other thing is we do put in ear tubes, and in adults, we do it in the clinic setting. For children, they have to go to the OR, and we do that right here at Bluff. Ear tube, everybody thinks it's a long thing. It's just a little dot. It's 1 millimeter, and they put it in.
Yeah.
So, and we cauterize for nosebleeds, and we use the microscope for the ears. We'll look into the ears to determine why the hearing loss is going on. And we also do biopsies of ears, nose, and throat too in the clinic setting, or we'll send the patient to surgery.
You guys do it all. If it's ear, nose, or throat, you do it. That's your specialty.
Right. Yes.
So Michelle, can you tell the viewers, how does your clinic work with the speech and audiology departments?
Sure. What we like to do is we like the patients usually to see audiology first if it's a hearing problem. Because this helps the appointment for the patient, then they only need one appointment. It's not like we see them and then they go to audiology. They go there first. We work real close in looking at the patients together with audiology. So we work together doing that, and we see patients mainly for audiology. Before the appointment is for hearing loss, if you have pain with your hearing, if you have vertigo, which is dizziness, which could be caused with the ear, if somebody's having chronic ear infections, or if somebody has ear drainage. And for speech, usually we see the patient first, and the doctor will look down the throat, and then he'll order a swallow study, and then usually he has you watch during the swallow study to see what is exactly going on. And then when we determine that, it's determined that we will have you come in and work with the patient to swallow better.
And are you guys, you guys must be located within close proximity on this campus to each other, so you can literally walk down the hall and talk with one another. I think that's really cool about going to a place like this, is it's not like, oh, I got to refer you to this building or that building. You guys actually work together as a really strong, cohesive team, and I think that's awesome. So, Michelle Messer, thank you so much for the information today. We're out of time already, can you believe it?
I know, that's good.
That's all the time we have for Wisconsin Doctors. We've been talking about speech and language and audiology here at Bluff Medical Center. From all of us here at Channel 57, we invite you to live longer, live better. We'll see you next time.